The idea is that after a full incubation period and 3 days without symptoms, that person is no longer shedding virus to infect others. So now let's put it in Guyana context. In Guyana, we have about between 45 and 50% asymptomatic. Now, are they truly asymptomatic? Or is it because at the time that we did the testing, they were asymptomatic? Because some of these asymptomatics eventually come on to develop symptoms. Now, at the time that we tested them, they were asymptomatic. But at the time, after a few days, they become symptomatic. When they become symptomatic, that rule still applies, that after 10 days of isolation, we add another 3 days without symptoms. And if they are still without symptoms for an extra 3 days, then they can be released. I think the question that you are asking boils down to, so what happens to persons who are truly asymptomatic right from beginning to end? The knowledge that has been amassed as a result of persons who have come down with COVID has clearly shown that after the incubation period, the viral shedding, the virus that is released is so minimal that they are not infected. There's either no viral shedding or so minimal that they are not infected. And that's the essence in not keeping these persons. Remember, in Guyana, we had persons who had been kept in isolation for 50 days, 60 days. And then when I sent for guidance from both Washington and Geneva, I was happy, a bad word to say, but I was happy to realize that it was not only in Guyana that we're having persons like that, and that there are many other countries that were having persons who were continually testing positive, even though they've been in isolation for several times. But it was shown that, yes, these persons can be released from isolation because they are no longer infected.